Have you ever had that feeling where your stomach decides to completely revolt against you?
Oh, yeah.
You know, the dreaded stomach bug?
Yeah.
Well, turns out there's often like this tiny but mighty culprit behind it. And today we are taking a deep dive into its world, norovirus.
Huh, it's interesting, how we just kind of brush it off as like a stomach bug, but it's actually a unique virus, and it's totally different from the flu, even though we call it the stomach flu.
Yeah, I have noticed that more people are like talking about norovirus lately.
Yeah.
Dr. David McCauley has this YouTube channel that's like blowing up right now. It's called Global RPH.
Oh, wow.
And he's been like breaking down all things norovirus. And you know what?
What's that?
He's hit over 10,000 subscribers in just a couple of months.
Wow, that's amazing.
Yeah, so talk about go viral.
Yeah.
But seriously, it's clear that people are really hungry for this kind of info.
Oh, yeah.
So let's get to it. Why does this distinction even matter between norovirus and the flu?
Well, because understanding how it works is key to, avoiding it and dealing with it.
Right.
Viruses and the flu have different ways of like operating in your body.
Okay.
You can think about it like this. They're playing different games with your body.
Okay, that makes sense. So let's talk about how common this actually is.
Yeah.
How common is norovirus?
It's alarmingly common.
Real?
In the U.S., there are between 19 and 21 million cases every single year.
Wow.
Which makes it the leading cause of foodborne illness, and it's responsible for nearly half of all outbreaks.
Wow, half of all foodborne outbreaks.
Yeah.
That's a lot higher than I would have guessed. What makes it so potent?
One factor is its contagiousness. Norovirus is incredibly efficient at spreading, especially in places like cruise ships or nursing homes where people are in close quarters.
Right.
And here's the kicker. You can still be contagious for up to 2 weeks, even after you feel better.
Wait, 2 weeks after your symptoms are gone?
Yeah.
That just seems like a recipe for disaster.
It definitely complicates things from like a public health perspective because people think they're in the clear, but they can unknowingly transmit the virus to other people.
Right.
It really underscores the importance of like thorough hand washing and isolating yourself even after you think you're over the worst of it.
Oh, for sure. So not only is it super contagious, but it also hangs around for a while.
Yeah.
Is there anything else that makes it so tough?
Yeah. Norovirus is a survivor.
What?
It can survive on surfaces for days, even weeks. And get this, it can withstand temperatures as high as 145 degrees Fahrenheit.
What?
Yeah.
That's hotter than a lot of cooking temperatures.
Yeah, hotter than most cooking temperatures.
Even if you think you're being careful with like food prep, it might not even be enough.
Right. It really highlights the need for stringent food safety practices, like thoroughly washing your produce and making sure that shellfish and seafood are cooked to the right temperatures.
Okay, so we know it's contagious, it hangs around, it's tough to kill.
Yep.
What about the symptoms? What should people be on the lookout for?
Norovirus usually hits fast, and hard symptoms typically appear within 12 to 48 hours after exposure.
Wow.
Yeah, the telltale signs are nausea, vomiting, diarrhea, and abdominal cramps.
Oh, yeah.
You might also experience like a low-grade fever, headache, body aches, fatigue, but how severe these symptoms are can vary from person to person.
Okay, so how do you know if it's just a run-of-the-mill stomach bug or something more serious that needs a doctor's attention?
That's an important question, and Dr. McCauley, who we mentioned earlier, actually addresses this in his videos.
Okay.
He points out some key red flags. So if your symptoms persist for more than 3 days, if you can't keep any liquids down for several hours, if you have bloody stools or severe abdominal pain, or if you show signs of dehydration.
Oh.
Yeah, those are all signs that you need to seek medical attention immediately.
Those are definitely some signs you can't ignore. Now, let's play detective here. How does this sneaky little virus actually spread? What are the main transmission routes?
The most common way norovirus spreads is through what's called the fecal-oral route.
Okay, so we're talking about good bathroom hygiene, right?
Yes, definitely hand washing after using the toilet.
Okay.
But it's not just about that the virus can easily contaminate food surfaces and even travel through vomit particles in the air.
Wait, what?
Yeah, so think about it. Someone doesn't wash their hands properly, then touches a doorknob or prepares food.
Oh.
Yeah, the virus can easily transfer to anyone else who comes into contact with those surfaces.
That makes you think twice about touching anything.
It does. It really does.
It really does.
And keep in mind that even tiny vomit particles can become airborne, especially during forceful vomiting. So being near someone who's sick can increase your risk of infection.
So it's food surfaces and even the air we breathe, this virus really has a lot of ways to get around.
Yeah, it does.
What about treatment? Is there anything that can actually kill norovirus?
Unfortunately, there's no specific antiviral treatment for norovirus yet.
Seriously, with all of our medical advancements, we still haven't cracked the code on this thing?
It's a tough one to target, and it's a problem with many viruses, not just norovirus.
Mm.
Okay.
One of the challenges is its rapid mutation rate. Norovirus is constantly changing.
Oh, wow.
Yeah, making it difficult to develop a drug that can consistently and effectively eliminate it.
So if there's no magic bullet cure, what can you do if you get hit with norovirus? What's the best way to deal with it?
Well, since there's no specific treatment, the focus shifts to supportive care. The most important thing is to stay hydrated.
Okay.
So this means sipping on clear liquids like water or oral rehydration solutions, which can help replace lost fluids and electrolytes rest, is also crucial to allow your body to fight the infection. And as your symptoms start to subside, you can gradually ease back into eating, starting with bland, easily digestible foods.
So basically, write it out and make yourself as comfortable as possible.
Exactly. And while medications aren't always necessary, your doctor might recommend antiemetics to reduce nausea and vomiting or antidiarrheal medications in certain situations.
Pain relievers can also help with headaches or body aches, but it's always important to consult with your healthcare provider before taking any medication, especially if you're dealing with children or individuals with underlying health conditions.
That makes sense. So we've talked about how contagious it is, the lack of a cure, and the importance of supportive care.
Right.
But let's shift gears to prevention. What are some practical steps listeners can take to minimize their risk of getting infected in the first place?
This is where we can really take charge. Prevention is key when it comes to norovirus.
Okay.
And thankfully, there are several things you can do to protect yourself and those around you.
Okay, lay it on us. We're ready to become norovirus fighting ninjas.
All right, first and foremost, make hand washing a non-negotiable ritual. Wash your hands thoroughly with soap and water for at least 20 seconds, especially after using the bathroom, changing diapers, and before preparing or eating food.
20 seconds feels like forever when you're just standing there, but it makes a difference.
It really does. And while hand sanitizers can be helpful when soap and water aren't readily available, they're not as effective against norovirus.
So hand washing reigns supreme. What about food safety? What should people keep in mind?
Always wash fruits and vegetables thoroughly before eating them, even if you plan on peeling them. Make sure shellfish and other seafood are cooked to the appropriate temperatures. And if you're sick, it's best to avoid preparing food for others altogether.
All great tips.
Yeah.
What about our surroundings? How can we keep our environments as norovirus-free as possible?
When it comes to cleaning, using chlorine bleach-based cleaning solutions on contaminated surfaces is key. Pay special attention to high-touch areas like doorknobs, light switches, and faucets.
Okay.
Yeah, these are the surfaces that are constantly being touched, so they're prime spots for the virus to linger.
So diligent hand washing, food safety, environmental cleaning are all crucial. Anything else people should keep in mind?
One of the most important things you can do is stay home if you're sick. It's a simple act of community care. Isolating yourself for at least 48 hours after your symptoms resolve can dramatically reduce the spread of the virus.
It can be tough to miss work or social events.
Yeah.
But in the case of norovirus, staying home is the responsible thing to do. It's about protecting others,
Yeah.
especially those who might be more vulnerable to complications.
Exactly. And speaking of complications, while most people recover from norovirus without any issues, certain groups are at higher risk of developing more severe symptoms.
Who are we talking about here?
Young children, elderly individuals, people with weakened immune systems, and those with underlying health conditions are all more susceptible to complications from norovirus.
Okay, and what kind of complications can arise?
Dehydration is a major concern, as is malnutrition, if someone's unable to keep food down for an extended period.
Right.
Norovirus can also exacerbate existing health conditions, making them more difficult to manage, and in rare cases, it can even lead to hospitalization.
That's a good reminder that even though norovirus might seem like a common and relatively mild illness, it can have some serious consequences for certain people.
Absolutely.
So we've covered a lot of ground here, from the basics of what norovirus is to how it spreads, how to prevent it, and what to do if you get sick. But what does the future hold for this persistent little virus?
Yeah.
Is there any hope for a vaccine or a cure on the horizon?
That's where things get really interesting. While we don't have a cure or a vaccine yet, there is ongoing research in both areas that offers a glimmer of hope.
Tell us more. What are the scientists working on?
Researchers are exploring various approaches to vaccine development, and some promising candidates are already in early clinical trials.
So there's a chance that someday we could have a vaccine that would protect us from this misery.
It's definitely a possibility, and in terms of treatment, scientists are also working hard to identify effective antiviral therapies that could shorten the duration and severity of norovirus infections.
That would be a game changer. Imagine being able to take a pill and just knock this virus out quickly instead of just suffering through it.
Exactly. While there are still challenges to overcome, these research efforts offer hope that we might one day have more effective tools to combat norovirus.
Well, this has been a fascinating, if slightly unsettling, deep dive into the world of norovirus.
Yeah.
We've learned that this tiny but mighty virus is responsible for millions of cases of illness each year, that it's incredibly contagious and resilient, and that there's no magic cure. But we've also learned that there are steps we can take to protect ourselves and others, and that there's hope for future treatments and vaccines on the horizon.
It really is a fascinating virus and one that's constantly evolving.
And sometimes it feels like it's evolving to outsmart us. Before we wrap up, part one of this deep dive, I want to leave our listeners with something to think about now that you know just how contagious and resilient norovirus is. What's one thing you'll do differently to protect yourself? And others? Will you be more diligent about hand washing? More mindful of food safety practices? Or maybe you'll be more proactive about staying home when you're feeling under the weather? Think about that while we take a short break, and we'll be back soon with more on norovirus.
Yeah, it's interesting that you bring that up, like being more proactive about staying home when you're not feeling well.
Yes.
That's a big one, especially considering how long it can stick around,
Right.
even after you think you're better.
It's a good reminder that sometimes the best way to take care of ourselves is to take care of other people.
Oh, for sure.
And on that note, are there any places or situations where you're more likely to run into norovirus?
Absolutely. Certain environments are particularly prone to norovirus outbreaks.
Okay.
So think about places like cruise ships, healthcare facilities, schools, daycare centers.
Right.
These are all environments where people are in close quarters sharing common spaces and surfaces, which creates the perfect storm for norovirus transmission.
Yeah, that makes sense when you think about it that way.
Right.
Lots of people shared spaces.
Lots of opportunities for that virus to spread.
Yeah, exactly.
That's why it's crucial to be extra vigilant about hygiene and prevention measures in these types of settings.
Okay.
Frequent hand-washing, disinfecting surfaces, and staying home when you're sick can really make a difference in preventing outbreaks.
So those small actions can have a big impact on a larger scale,
Oh, absolutely.
especially in those close contact environments.
Exactly. And as we continue to learn more about norovirus, hopefully we'll develop even better strategies to prevent and treat this common foe.
Speaking of learning more, I have to say, Dr. McCauley does a fantastic job of making this complex medical information really easy to understand.
He does.
His YouTube channel has become such a valuable resource for people who are looking for reliable information about norovirus.
It's amazing how he can communicate scientific concepts in a way that's engaging and relatable.
Yeah.
He's clearly passionate about making science accessible to everyone.
Yeah, and it really resonates with his audience.
Yeah.
He really has a knack for explaining things in a way that makes you want to keep learning.
Right.
And that's so important, especially when it comes to public health issues like this.
Absolutely.
The more informed people are, the better equipped they'll be to make choices that protect themselves and their communities.
I couldn't agree more. Knowledge is power.
Right.
And when we understand how something works, we're less likely to be afraid of it and more likely to take the right steps to prevent it.
Exactly.
Yeah.
So for anyone listening who wants to dive deeper into norovirus, we highly recommend checking out Dr. McCauley's Global RPH channel on YouTube.
Absolutely.
You won't be disappointed.
It's a goldmine of information, and it's presented in a way that's both informative and entertaining.
So we've covered a lot of ground today exploring the ins and outs of norovirus.
We have.
From how it spreads to how to prevent it and what to do if you get sick.
Right.
We've explored it all thanks in part to the information from Dr. McCauley.
He's a great resource.
But before we wrap up this deep dive, I have one final question for you.
Okay, I'm all ears.
Knowing what we now know about how easily norovirus spreads and how tough it is to combat, what's one small change you could make in your own life to reduce your risk of getting infected? Something as simple as washing your hands more often, being more mindful of food safety, or maybe even speaking up when you see someone not following proper hygiene practices.
That's a great question.
Yeah.
It's easy to get overwhelmed with all this information and feel powerless against a virus like this.
Right.
But as you said, even small changes can make a big difference. And sometimes just being aware of the risks is enough to motivate us to be more careful.
I think that's a great point to end on. We're not helpless against norovirus.
No, we're not.
We have the knowledge and we have the power to take action, even in small ways.
We do.
And those actions can have a ripple effect,
Absolutely.
protecting not just ourselves, but also the people around us.
Well said.
It's kind of funny, we've been talking about all these serious aspects of norovirus,
Right.
but I can't help but think about, you know, how this tiny little virus
Yeah.
can like bring entire cruise ships to a standstill.
It's true. The impact of norovirus is often underestimated. It can disrupt travel plans, shut down schools, put a strain on healthcare systems.
It's a reminder that, even something we can't see with the naked eye
Yeah,
can have this huge impact on our lives.
absolutely.
And speaking of things we can't see, we talked about hand sanitizers earlier
Right,
and how they're not as effective against norovirus as like soap and water.
right.
Are there any situations where you'd still recommend using them?
That's a great point. While hand washing with soap and water is always the best defense, there are times when it's just not practical. If you're on the go and you don't have access to a sink,
Right.
an alcohol-based hand sanitizer with at least 60% alcohol can help reduce the number of germs on your hands.
So have a good backup option when you're in a pinch.
Think of it as a temporary shield until you can properly wash your hands.
Yeah.
It's all about having those layers of protection.
Makes sense. It's like having a plan B for germ warfare.
That's a great way to put it. And on the topic of being prepared, another important thing is staying informed about potential norovirus outbreaks in your community.
Oh, okay. How can people stay up to date on that information?
Local health departments often issue alerts or advisories.
Okay.
When there's an increase in norovirus cases, you can also check the CDC website, which provides updates on outbreaks across the country.
So a little bit of vigilance can go a long way.
It really can.
Knowing what's happening in your area can help you make, informed decisions about your own health and take those extra precautions when you need to.
Exactly. Staying informed is a crucial part of staying protected.
Well, I think we've covered just about everything there is to know about norovirus.
I think so.
From how it spreads to how to prevent it, what to do if you get sick.
Yeah,
We've explored it all,
we have.
thanks in part to the great information from Dr. McCauley.
Yeah, it's been a really insightful deep dive into a topic that affects millions of people every year. Hopefully, our listeners feel empowered with a better understanding of norovirus and the tools they need to stay healthy.
That's what we aim for. Knowledge is power.
Absolutely.
And when it comes to something like norovirus, the more we know, the better equipped we are to avoid it.
Absolutely. And if you're ever feeling unsure or you want to learn more, remember resources like Dr. McCauley's YouTube channel are just a click away. There's a wealth of reliable information out there to help us navigate the world of germs and viruses.
Well said. And with that, we wrap up another episode of The Deep Dive. Thanks for joining us. And until next time, stay curious, stay informed, and stay healthy.